Thank you. Good afternoon, everyone. It's good to be here today to present this to us. My name is Olalekan Owonikoko. Well, in my language, that means that money is the important thing. And I think you would agree with me that money is important. All right, today I'm dressed in a black kaftan that is typical of young Nigerian professionals. It just works for us. And I'm tall, dark, and handsome. Thank you for that. All right, so today I'm talking about accelerating disability governance through data. And I think that governance cuts across all of the work that we're doing. There's been a lot of amazing work that people are doing across the continent on inclusion. But it is important that change starts at policy level. I mean, the biggest change that we can ever experience has to happen at the policy level. And that's why we are working towards advancing governance in this area. Of course, this is an offshoot of the work we've done in the last 10 years in Project Enable Africa, where we work out of Lagos to advance the cause of inclusion for persons with disabilities, promoting the rights, empowerment, and inclusion. In the last 10 years, we've supported up to 5,000 persons with disabilities to start and scale their businesses across 6 African countries. These are people who had business ideas or people who were already running their businesses, but who have been able to scale. Some who have had just their business in one location and now have had up to 3 or 4 branches of their businesses. We've trained and placed over 1,000 youth with disabilities in decent jobs in the corporate sector. And one of the success stories is that we've had people who have been working in the places they've been placed for over 4 years and who have risen along the ranks, and others who have moved to newer jobs. And in the course of that, we've helped about 150 organizations to become more disability confident employers. And the last part of our pillars is about research and disability governance. We've produced about 3 reports on disability inclusion, one including the Oral History Project, which attempts to create a sort of documentary, the journey of disability inclusion in Nigeria, of course, so that we can learn from, what has worked and what we need to do. And of course, the ICT empowerment, over 10,000 persons with disabilities have been equipped with ICT skills, and some of them have become freelancers, some of them have gotten jobs because of those skills. Now, one of the learnings that we've had over the years in our work at Project Enable Africa is that disability data matters. And for many of us within the African continent, there is not adequate or complete data on disability. Many times what we usually have is a sort of aggregated data offshoot of global data statistics, but not peculiar to countries or our society. And that is why this is important. And the role of data in inclusive governance is important because data shapes policy. That is how we are able to make a point, make a case, and show where there are gaps, where there are where we need to be fair in the policies. And of course, it makes the invisible populations visible when policymakers are having conversations. And of course, it helps us to drive evidence-based changes in the society. Disability data helps to design inclusive policies that reflect the real needs of the population of persons with disability. With that, resources can be properly allocated in the areas of need based on accurate evidence. And we can monitor and see the impact. We can evaluate these policies and see the impact that they are making. And then, of course, along the implementation of some of our newer laws on disability inclusion, we can identify the gaps and see where we need to pay more attention in terms of access and services. And then finally, to strengthen accountability on the part of government policies and implementations. Of course, like I said earlier, that there's incomplete and outdated national data on disability inclusion generally, and sometimes this data is not a mainstream data. It's not present where it is needed. And then finally, this definitely limits planning and services, and that is where our solution Access 360 comes into play. This is a platform that collects, aggregates, and publish disability data in a bid to inform policy, in a bid to inform policymakers to incorporate that data in all that is being done. Right now, the platform is focused on Nigeria, but in the coming years, expanding to include data for all African countries, the entire continent. The platform, the aim of the platform is to collect, analyze, and then publish data in a way that is digitally accessible, in a way that it can be easily consumed by anyone that needs that data, especially policy makers. And it's an interesting and beautiful platform where, for example, we have trained persons with disabilities to become data analysts and data collectors, so that the data on inclusion is coming from the community itself. And right now in Lagos, we have a team of persons with disabilities who have been trained on data collection, and some of the data here has been collected by them, which brings us to one of the features, which is called the eyewitness feature of this platform, where persons with disability can see what is happening in their society across all the states in Nigeria, and then report on those policies or those programs. For example, the platform highlights all the states in Nigeria that has enacted or revamped or created their own disability policy for the state. And you can see states that do not have, you can see states that have. And where a state has, you can see where the agency is, what the agency is doing, the sort of allocation and the funding that has been, that the state has, and what they are doing with it. And yes, the eyewitness helps us to gather some of those data. Right now, the data that we have is not primary data because, of course, there's a gap in data collection, but there is, secondary data that is gotten off, the Nigerian Bureau of Statistics, the data that they can give us, and some secondary research that we have done ourselves with the help of the fellows that have become data collectors and analysts. A direct impact of this platform is that we have now been able to publish the Nigerian Disability Inclusion Report that analyzes and shows what the state of inclusion currently is in Nigeria. And that involves a sort of state ranking to show the states that are disability inclusive, or the rate at which a state is inclusive in terms of their health policies, in terms of education, in terms of programs and projects that exist within that state. And this has helped us to start conversations with policymakers, with the Ministry of Humanitarian Affairs, the Population Commission, to begin to have this conversation, especially in line and in anticipation of the population census that would be coming up shortly in the country of Nigeria. Right, so this report is one of the direct impacts of Access 360, and we hope that over the years we can, expand on this, and this will become a very useful tool to make recommendations based on real data to the government. Some of the opportunities that exist with Access 360, because it's a platform that is growing, it's a platform that we're currently working on constantly, is first of all to be able to collect primary data, and that is why we're training persons with disabilities to become data collectors and data analysts, where we can collect data across the country, real-time data that reflects what is happening in the country. And then to leverage artificial intelligence to collect and analyze data in real time. And that's where support and partnership from already established organizations and can come in to help with this part. And then lastly is to continuously have persons with disabilities collect data and analyze the data and ensure that this is an inclusive journey for every one of us. Our call to action today, our expectations or what we desire happens is that beyond what we are doing at Project Enable Africa with Access 360, that every other person who is within the inclusion space can begin to invest in inclusive, disaggregated, and accessible data system to build capacity among data collectors so that we can have adequate collection of data, and to encourage open data policies and ethical standards, and then to center the voices of youth with disabilities in data design and dissemination. And we're open to partnership to support, to scale this platform within Nigeria and outside Nigeria so that in the coming years, we can at every time T pinpoint what the state of inclusion really is in Nigeria and in Africa. Thank you.
Thank you very much. Do we have any questions, comments? Questions, comments?
Thank you for your excellent presentation. In Kenya, we have data protection acts for people's information. So how do you navigate that across countries that have different laws on data?
Thank you for your presentation.
Okay. So I think that an important part is the partnership with the existing bodies that do the work of data. For example, we work extensively with the Nigerian Bureau of Statistics to ensure that all of our processes are in line with the necessary data protection policies that exist in the nation. And they were also part of the training for the data collectors and the data analysts, so ensure that that part of the work on the building of the platform exists. So in our expanding to other continents, that would be a key part of the process, of course, because it's something we already do to work with the existing bodies that already collect data and that already manage data policies. Yes.
Thank you for your presentation. I do not take anything from that presentation, but it's just an observation that the PowerPoint, I think there's more that needs to be done in relation to making PowerPoint presentations accessible. Your font size was a bit small. I know there's some guidelines on PowerPoint making them accessible. I think you should consider that. Yeah. But the presentation was very informative. Thank you.
All right, thank you.
All right, questions. Quick, in 30 seconds.
Yeah, mine is quick. How do you deal with the invisibility of some disabilities in research? Like in most cases, you find that when you're looking for data, especially for the deaf-blind, you really find them. So how do you deal with such?
All right. So that's why we are working with persons with disabilities to be the data collectors within the community. And that's why it's a community approach to gather data. We already have existing partnership with all clusters of disabilities in Nigeria, which means that our data collectors are coming from all of the clusters. With that, we have a sort of mapping of all the persons with disabilities within the state, within each state, working with the agency, and with that, we're able to, have like an holistic spread of data collectors and, data that is collected. Yeah.
Okay, mine is about data collection also, especially for children with, under neurodiversity. So how are your, I've heard you have said about mapping, of which it's a good one because mapping is helping us even in Kenya, especially for drugs for children with epilepsy. So mine is, do you have an accurate data for children with neurodiversity and person with neurodiversity? And if you have it, how are you guys going about it? Because the last time that we are having some things, a conference with Nigerians, they're saying that the data was not accurately made, just like for us Kenyans, yeah?
Yeah.
Thank you.
So I would say that currently we do not have that data. It doesn't exist right now, which is one of the reasons why this is important. And a key strategy for us is to work with the Population Commission, especially in the next census that is happening, so that it can be completely inclusive and that data can be collected. However, for some states, there is a bit of advancement in the collection of that data, like Lagos State, because of the heavy presence of the disability policy, right? So we leverage on both of that, and in states where there's no much data, we work on our, the community of persons with disability working as data collectors, and by extension, the Population Commission.
All right, thank you very much, sir, for that presentation.